Hello, my name is Stephanie Luna, and I've been with the County of Riverside Human Resources for the last 6 years, and I've really enjoyed it. Today, I will be walking you through our orientation for Riverside University Health Systems. Please make sure you have pen and paper available, as I will be providing you with important information. Providing excellent customer service. Who are our customers? Patients, patient family members, and visitors, vendors, coworkers, peers, other county departments and employees, outside pharmacies, outside healthcare organizations, and the media. Our customers are everyone with whom we come into contact with. Customer expectations. What do you expect from healthcare professionals? Honesty, professionalism, courtesy, respect, compassion, and accommodations. And what do our patients expect from us? Honesty, professionalism, courtesy, respect, compassion, and accommodations. The county's expectations. What are two important things that the County of Riverside expects from you? Professional appearance and professional behavior. Professional appearance. Adhere to the RUHS dress code policy. Neat, clean, unwrinkled garments, hosiery must be worn. No open-toed shoes in patient care areas. Business appropriate, healthcare appropriate, and always wear your name badge in easy view and above your waist. Accreditation. Accreditation is a risk reduction activity. Compliance with standards is intended to reduce the risk of adverse outcomes. The National Patient Safety Goals have been created by the Joint Commission, and the purpose is to highlight problem areas in healthcare and develop solutions to system problems. Accreditation Continued. The Joint Commission accreditation process focuses on continuous improvement in key areas of patient safety and quality. The Joint Commission survey process is voluntary and unannounced. A constant state of readiness means that we are providing the highest level of care all day, every day, and are ready for surveyors to evaluate us at any time. Regulatory compliance. RUHS supports the commitment to improve healthcare safety. RUHS adheres to guidelines from the California Department of Public Health, centers from Medicare and Medicaid, and the Joint Commission. Surveys from CMS or CDPH are not voluntary and are unannounced. RUHS Hospital Security. All employees of the hospital, including students, interns, and residents, shall wear an identification tag bearing their name and classification. RUHS interaction with local and state law enforcement agencies. RUHS provides patient care for both county and state inmates. All inmates transported to the hospital are escorted by correctional officers or correctional deputies from their respective institution. Typical locations where inmate patient care takes place is our detention care unit and our detention care clinic, both of which are located on the 4th floor. Security note. To ensure the safety of hospital patients, employees, and visitors, never release information regarding an inmate. When treating an inmate, never turn your back to the inmate or leave any medical instruments or supplies within reach of the inmate, as they may be able to use them as a weapon against you or security staff. Hospital security and Moreno Valley Police Department. The hospital has law enforcement coverage by Moreno Valley Police Department 24/7. If you dial 911, your call will go to the hospital emergency switchboard operator. If you push the security button, your call will go to the security pod, and a Riverside County Sheriff's Correctional Deputy will be answering that call. Hospital security. To ensure the safety of employees and patients, correctional officers or correctional deputies are to transport inmates in elevator S1. The elevator is controlled by the security pod and has a surveillance camera to monitor inmate transportation. Is violence part of your job description? Healthcare workers, social service providers, late-night employees, and law enforcement officers face a greater than average risk of violence, and OSHA has issued specific guidelines to protect them. There are several factors to consider for employers and employees and other fields to assess the risk of violence. The following are often linked with the high-risk violence. Affects people's freedom, family, or money. working in high crime areas per police data, parking your car in the same place and are first in or last out of the building, personally delivering bad news, employees with a monopoly on administration of services, getting caught between disgruntled coworkers, their family, or estranged boyfriends or husbands, working alone, late, or in small numbers. Types of violence. Type 1, the assailant has no legitimate relationship to the workplace. This usually involves a robbery or other criminal act. Type 2, the person who commits type 2 acts of violence is the recipient of services provided by the affected workplace. So client, customer, patient, or criminal. Type 3. These types of incidents usually consist of assaults by someone who has a current or previous employment-related involvement with the workplace. So current or former employee, spouse, significant other, relative, or friend, someone who has a real or an imaginary grievance with an employee. And type 4, the person who commits type 4 acts of violence is the person who does not work there but has a personal relationship with an employee at the workplace. And this is where domestic violence can spill over into the workplace. Grievances and complaints. Patient rights. According to California Department of Public Health, Centers for Medicare and Medicaid, the Joint Commission, in Title 22, a patient and or family member has the right to file a grievance complaint. We, as RUHS, must have established process for proper resolution of a grievance. Is it a grievance or a complaint? A complaint can be addressed and resolved at the point of the service, and the patient walks away satisfied. A grievance requires more work time documentation and involves assistance from the patient advocate office. How to resolve a complaint. Listen and provide assistance, intervention, or a referral. Refer to a director or an appropriate member of management when you need assistance. Is the patient satisfied? If yes, you've accomplished your mission and a positive patient experience has been achieved. If no, refer to the patient advocate office for further assistance. Is it a grievance? Is it in writing, including fax or email? Does the patient want a response? Does it involve care provided, abuse or neglect, billing issues related to quality of care? Yes, refer to the patient advocate office. What if a patient wants to file a grievance? Contact the patient advocate office at 951-486-4313 or extension 64313, room E1008, Monday through Thursday, 8 a.m. to 5 p.m., and Friday, 8 a.m. to 4 p.m. Provide a grievance form when requested. Point out information from the patient guide and or the patient rights poster. Well, that concludes our orientation for today. I hope you enjoyed our orientation and we look forward to seeing you. Thank you for your time and welcome to Riverside University Health Systems.